Welcome to the Jefferson County Public Health Volunteer Training for responding to a public health emergency. We appreciate your willingness to assist Jefferson County Public Health with responding to this public health emergency event. Your participation will help to provide the resources and assistance needed to help the community. You are a critical part of this response, and we want you to feel confident and prepared to fulfill your role and assist with this emergency event. During this training, you will be provided with information regarding the medication distribution process, the roles within a point of dispensing, or what is also referred to as a pod, the Incident Command Structure, or ICS, a review of some of the materials and documentation you'll receive, as well as the Jefferson County Public Health Identification Requirements. Training objectives also include the Code of Conduct, information regarding safety and security, public information and the media, protected health information and the Health Insurance Portability and Accountability Act, confidentiality, personal protective equipment, information regarding stress management, and deactivation and demobilization. To begin, we would like to provide you with some background information about why you have been asked to participate in this response. There has been a public health emergency that requires the immediate administration of medication to prevent illness. You will be provided with additional information regarding the emergency in the documents you will receive as part of your training and information materials. Jefferson County Public Health is responding to this event by providing the needed medications to the Jefferson County community members in the affected areas. The affected community members are being notified to go to points of dispensing locations, or pods, which are being set up in several locations throughout Jefferson County to pick up the medication being provided to respond to this event. These pods are open to the public. We need people to help run these pods, and you are receiving this training to prepare you to help with this response. You will also receive medication at the pod you are assigned to. The initial dispensing operations are expected to last 36 hours and 3 12-hour shifts. The response operations may be extended beyond the 36 hours depending on the scope and scale of the event. You will be provided emergency medication at the POD location that you are assigned to. You will also be provided emergency medication to take home to your family at the end of your shift. The medications being dispensed at the pods come from a federal stockpile distributed by the Center for Disease Control called the Strategic National Stockpile. These medications are stored at locations throughout the United States to enable a quick response to a public health emergency. These medications are shipped from their holding locations to a state warehouse called the Receipt, Storing, and Staging Location, or the RSS. There, they are inventoried and packaged for shipment to regional transfer points, also called RTPs. At the regional transfer points, the medications are again divided and packaged into quantities to be delivered to dispensing sites called points of dispensing, or pods, where they are dispensed to the public. As part of the Jefferson County Public Health Response Team, you'll be working at one of the Jefferson County points of dispensing. When you arrive at your work site, you will receive your job assignment and a job action sheet outlining your specific role and responsibilities. Some of the roles within a point of dispensing include the pod manager, who is the person that manages the overall operations of the pod and the pod staff. The inventory and administrative manager is responsible for tracking and securing the medication and pod supplies, as well as maintaining the documentation necessary to run the pod. The greeters are responsible for welcoming the pod participants, for providing them with the paperwork and forms needed to receive medication, and answering the participants' initial questions. Screeners are responsible for reviewing the participant screening form called the Head of Household form. This determines if the participants are eligible to receive the medication being dispensed or to identify specific health considerations that may require further evaluation prior to receiving medication. The dispensers are the pod staff members who will be providing the medications being dispensed. During a declared public health emergency, the pod staff members dispensing medication do not need to be medical professionals or have medical credentials. If vaccines are being dispensed, then the pod staff providing the vaccines must have the medical credentials required to provide injections. Along with the dispensing staff members, there will also be medical evaluators who must be medical professionals with the credentials and qualifications, such as a doctor or nurse, to make decisions regarding medical conditions and medications. If a participant screening form has indicated that they need additional evaluation prior to receiving the medication, medical evaluators will consult with the participant to determine if they were able to receive the medication or if the participant needs to be referred to their personal medical care provider for further evaluation. The exit monitors hand out any additional paperwork that may be needed, as well as answer any final participant questions. The runners deliver materials, supplies, or medications to stations within the closed pod as needed. Behavioral health personnel may also be on site at the pod and are professionals who are available to assist both the pod staff and pod participants with any stress or anxiety that may be experienced while at the pod. Security staff are also available and are professional staff who are on site at the pod to assist with any security issues that may arise. You will receive a position assignment sheet and a job action sheet when you arrive at your work site, which will outline your specific role and responsibilities. The organizational structure used to manage the workforce at the regional transfer point and the points of dispensing is called the Incident Command Structure, or ICS. The Incident Command System, or ICS, is part of a standardized system for organizing and running emergency response activities. ICS determines the system and structure for managing response activities and personnel. Jefferson County Public Health uses the Incident Command Structure for managing all public health emergency response activities. When you report to your worksite, you will receive an information packet which will include a position assignment sheet. The position assignment sheet will indicate the role you will be filling, the position of the on-site supervisor you will be reporting to, and the location of your worksite. Your information packet will also include a job action sheet, which will clearly outline your specific responsibilities. The position you will be assigned will be part of the operations section. The operations section are the people performing the response activities. In the email in which you received this training presentation, you should have also received a staff and volunteer registration form and a release of liability form. Please print, review, fill out, and sign these two documents and bring them with you to your worksite. If you do not have access to a printer, additional copies of these forms will be available at your worksite. You also should have received documents that provide additional information regarding the event we are responding to, the agent or illness, the medications being dispensed, as well as a map to your worksite location. When you arrive at your worksite, you will also receive a position assignment sheet, a job action sheet, a Jefferson County Public Health issued identification badge, emergency medication, as well as any additional information or training as needed. When you arrive at your worksite, please be sure to check in at the Staff and Volunteer Sign-In table and to sign in on the Staff and Volunteer Sign-In sheet. You will receive a Jefferson County Public Health issued identification badge after you present a state-issued identification such as a driver's license. Please be sure to wear this identification badge at all times when working as part of the Jefferson County Public Health Response Team. You will then receive your position assignment sheet and job action sheet, which will outline your specific role and responsibilities. Please do not bring children, family members, friends, or pets to the worksite, and please be aware that firearms are prohibited at all Jefferson County Public Health worksites. If you do need to bring personal items such as medication into the worksite, please consider using a hip pack or similar device that can be securely attached to your body and held out of the way. Due to the nature of the response, all staff and volunteers working as Jefferson County Public Health responders must wear a Jefferson County Public Health issued identification badge at all times while in their response role. Please remember to bring your state-issued identification, such as a driver's license, with you to your worksite. You will not be able to participate as a Jefferson County Public Health responder without showing a state-issued identification and receiving a Jefferson County Public Health identification badge. The badge you will receive will have your name, your position, your worksite location, and the dates of your assignment. Please do not give your badge to anyone else. If your badge is lost or stolen, please notify your on-site supervisor immediately. While participating as a Jefferson County Public Health representative in the response activities, please remember to treat all individuals with consideration and respect. Please act professionally and responsibly. If you have any questions or concerns, please be sure to ask your worksite on-site supervisor for clarification or assistance. Please act only within the capacity in which you are assigned. And please do not take any photos or videos or post anything on the internet or social media websites without authorization from the Public Health Information Officer or your on-site supervisor. Safety and security during this response is everyone's responsibility. Please follow the directions provided by your on-site supervisor, the safety officer, or other appropriate authority. Follow safe workplace practices, including participating in any applicable training sessions, using appropriate personal safety equipment, and reporting any incidents, injuries, or unsafe situations. Please report any suspicious activity to your on-site supervisor. Don't consume alcohol or illegal substances while at the workplace. Please be aware of anyone who is not properly badged or attempts to access restricted areas or areas where medication or supplies are being stored. Anyone who may be monitoring the site or who asks questions related to access or security, or anyone who is taking photos, using binoculars, or making diagrams of the area. If you notice anyone doing any of these things, try to write down a detailed description of the person and/or vehicle, and immediately notify your on-site supervisor or site security. Please be cautious not to discuss security procedures where they can be overheard, and if in doubt, please report. During emergencies and disasters, the media is often present taking photos and interviewing people to gain information to report to the public. For that reason, pre-identified, trained, and qualified public information staff will be available to provide information to the media. It is critical that accurate and consistent information is provided to the public. If you are approached by someone asking questions regarding the response activities, please do not answer any questions and refer them to the public information officer or to your on-site supervisor. Jefferson County Public Health staff and volunteers may encounter personal medical or non-medical information about the people they serve. This information is protected by law and out of respect for the individual. Please do not share any personal or medical information that is given to you, or that you may see or overhear unless you are delivering the information to a person who is authorized to receive it. Please be cautious not to leave documentation containing personal information unattended, and follow all instructions regarding confidentiality and securing documentation. Due to the nature of this event, emergency response activities and locations may be considered confidential. Please do not disclose locations or types of operations unless given authorization to do so. You may discuss important issues with family members before responding, such as how long you will be away from home, how you can be reached, and how your family can stay safe in your absence. Depending on the event and your role, you may be required to wear personal protective equipment such as a reflective vest, a protective mask, or gloves. Please follow instructions regarding personal protective equipment and ask your on-site supervisor if you have any questions or concerns. While emergency response work may be personally rewarding, the impacts of the work and the involvement with responding to a crisis can have an effect on responders. Steps can be taken to minimize those effects. Be sure to take breaks when needed to stay hydrated with water. If you are experiencing stress or needing assistance with your responsibilities, please let your on-site supervisor know. And if needed, your on-site supervisor can provide you information regarding behavioral health resources or services. Please do not leave the worksite without letting your on-site supervisor know, and please return any equipment or supplies checked out to you. Also, it's very important that you remember to sign out on the staff and volunteer sign-in, sign-out sheet before leaving. You may be asked to work additional hours if the response requires. The maximum shift you can work is 12 hours. You may be given the option of returning after a designated rest period. The person working at the staff and volunteer registration station will be able to give you information regarding additional work shifts needed when you check out. When the event has ended, the response activities and response sites will be demobilized. You may be asked to help pack up supplies and resources, take down tables and chairs, inventory supplies, and clean and return the facility to the pre-event condition. Again, before leaving your work site, please be sure to notify your on-site supervisor and to sign out on the staff and volunteer sign-out sheet. This presentation has provided you with the training and information you will need to begin your work as a JCPH response partner. Please review all of the paperwork included in the email you received with this presentation. Please print, read, sign, and bring with you to your worksite the registration form and the release of liability form. If you are unable to print these documents, there will be extra copies that you can fill out at your worksite. When you arrive at your worksite, please check in at the staff and volunteer registration station. You will need to show your state-issued identification, such as your driver's license, to receive your Jefferson County Public Health Identification Badge. Remember to wear your badge at all times while on the worksite. You will be given your position assignment and a job action sheet when you arrive at your worksite. Thank you for your willingness to help with this emergency response. Your time and contribution will help the community to respond and recover more effectively.